Hello everybody. In this video we will talk about heart disease. So let's get started. First, who gets heart disease? Heart disease is the leading cause of death in the United States, according to the Centers for Disease Control and Prevention, CDC. In the United States, 1 in every 4 deaths is the result of a heart disease. Heart disease doesn't discriminate. It's the leading cause of death for several populations, including Caucasians, Hispanics, and African Americans. Almost half of Americans are at risk for heart disease, and the numbers are rising. While heart disease can be deadly, it's also preventable in most people. By adopting healthy lifestyle habits early, you can potentially live longer with a healthier heart. What are the different types of heart disease? Heart disease encompasses a wide range of cardiovascular problems. Several diseases and conditions fall under the umbrella of heart disease. Types of heart disease include arrhythmia. An arrhythmia is a heart rhythm abnormality. Atherosclerosis. Atherosclerosis is a hardening of the arteries. Cardiomyopathy. This condition causes the heart's muscles to harden or grow weak. Congenital heart defects. Congenital heart defects are heart irregularities that are present at birth. Coronary artery disease, CAD. CAD is caused by the buildup of plaque in the heart's arteries. It's sometimes called ischemic heart disease. Heart infections. Heart infections may be caused by bacteria, viruses, or parasites. What are the symptoms of heart disease? Different types of heart disease may result in a variety of different symptoms. Arrhythmias. Arrhythmias are abnormal heart rhythms. The symptoms you experience may depend on the type of arrhythmia you have, heartbeats that are too fast or too slow. Symptoms of an arrhythmia include lightheadedness, fluttering heart or racing heartbeat, slow pulse, fainting spells, dizziness, chest pain. Atherosclerosis. Atherosclerosis reduces blood supply to your extremities. In addition to chest pain and shortness of breath, symptoms of atherosclerosis include coldness, numbness, unusual or unexplained pain, weakness in your legs and arms. Congenital heart defects. Congenital heart defects are heart problems that develop when a fetus is growing. Some heart defects are never diagnosed. Others may be found when they cause symptoms, such as blue-tinged skin, swelling of the extremities, shortness of breath or difficulty breathing, fatigue and low energy, irregular heart rhythm. Coronary artery disease, CAD. CAD is plaque buildup in the arteries that move oxygen-rich blood through the heart and lungs. Symptoms of CAD include chest pain or discomfort, a feeling of pressure or squeezing in the chest, shortness of breath, nausea, feelings of indigestion or gas. Cardiomyopathy. Cardiomyopathy is a disease that causes the muscles of the heart to grow larger and turn rigid, thick, or weak. Symptoms of this condition include fatigue, bloating, swollen legs, especially ankles and feet, shortness of breath, pounding or rapid pulse. Heart infections. The term heart infection may be used to describe conditions such as endocarditis or myocarditis. Symptoms of a heart infection include chest pain, chest congestion or coughing, fever, chills, skin rash. What are the symptoms of heart disease in women? Women often experience different signs and symptoms of heart disease than men, specifically with regards to CAD and other cardiovascular diseases. What's more, 80% of the women in the study reported experiencing these symptoms for at least 1 month before their heart attack occurred. Symptoms of heart disease in women can also be confused with other conditions, such as depression, menopause, and anxiety. Common heart disease symptoms in women include dizziness, paleness, shortness of breath or shallow breathing, lightheadedness, fainting or passing out, anxiety, nausea, vomiting, jaw pain, neck sweats pain, back pain, indigestion or gas-like pain in the chest and stomach, cold. What causes heart disease? Heart disease is a collection of diseases and conditions that cause cardiovascular problems. Each type of heart disease is caused by something entirely unique to that condition. Arrhythmia causes diabetes, CAD, heart defects, including congenital heart defects, medications, supplements, and herbal remedies, high blood pressure, hypertension, excessive alcohol or caffeine use, substance use disorders, stress and anxiety, existing heart damage or disease. Congenital heart defect causes. This heart disease occurs while a baby is still developing in the womb. Some heart defects may be serious and diagnosed and treated early. Some may also go undiagnosed for many years. Your heart's structure can also change as you age. This can create a heart defect that may lead to complications and problems. Cardiomyopathy causes. Several types of cardiomyopathy exist. Each type is the result of a separate condition. Dilated cardiomyopathy. The weakened heart may be the result of previous damage to the heart, such as the kind caused by drugs, infections, and heart attack. Hypertrophic cardiomyopathy. This type of heart disease leads to a thicker heart muscle. It's usually inherited. Restrictive cardiomyopathy. It's often unclear what leads to this type of cardiomyopathy, which results in rigid heart walls. Heart infection causes. Bacteria, parasites, and viruses are the most common causes of heart infections. Uncontrolled infections in the body can also harm the heart if they're not properly treated. What are some risk factors for heart disease? There are many risk factors for heart disease. Some are controllable, and others aren't. The CDC says that around 47% of Americans have at least one risk factor for heart disease. Some of these risk factors include high blood pressure, high cholesterol and low levels of high-density lipoprotein, HDL, the good cholesterol, smoking, obesity, physical inactivity. Smoking, for example, is a controllable risk factor. People who smoke double their risk of developing heart disease, according to the National Institute of Diabetes and Digestive and Kidney Diseases, NIDC. People with diabetes may also be at higher risk for heart disease because high blood glucose levels increase the risk of angina, heart attack, stroke, CAD. If you have diabetes, it's essential to control your glucose to limit your risk for developing heart disease. How is heart disease diagnosed? Your doctor may order several types of tests and evaluations to make a heart disease diagnosis. Some of these tests can be performed before you ever show signs of heart disease. Others may be used to look for possible causes of symptoms when they develop. Physical exams and blood tests. The first thing your doctor will do is perform a physical exam and take an account of the symptoms you've been experiencing. Then they'll want to know your family and personal medical history. Genetics can play a role in some heart diseases. If you have a close family member with heart disease, share this information with your doctor. Blood tests are frequently ordered. This is because they can help your doctor see your cholesterol levels and look for signs of inflammation. Non-invasive tests. A variety of non-invasive tests may be used to diagnose heart disease. Electrocardiogram, ECG or EKG. This test can monitor your heart's electrical activity and help your doctor spot any irregularities. Echocardiogram. This ultrasound test can give your doctor a close picture of your heart's structure. Stress test. This exam is performed while you complete a strenuous activity, such as walking, running, or riding a stationary bike. During the test, your doctor can monitor your heart's activity in response to changes in physical exertion. Carotid ultrasound. To get a detailed ultrasound of your carotid arteries, your doctor may order this ultrasound test. Holter monitor. Your doctor may ask you to wear this heart rate monitor for 24 to 48 hours. It allows them to get an extended view of your heart's activity. Tilt table test. During it, you're strapped to a table and slowly raised or lowered while they monitor your heart rate, blood pressure, and oxygen levels. CT scan. This imaging test gives your doctor a highly detailed X-ray image of your heart. Heart MRI. Like a CT scan, a heart MRI can provide a very detailed image of your heart and blood vessels. Invasive tests. If a physical exam, blood tests, and non-invasive tests aren't conclusive, your doctor may want to look inside your body to determine what's causing any unusual symptoms. Invasive tests may include cardiac catheterization and coronary angiography. Your doctor may insert a catheter into your heart through the groin and arteries. The catheter will help them perform tests involving the heart and blood vessels. Electrophysiology study. During this test, your doctor may attach electrodes to your heart through a catheter. When the electrodes are in place, your doctor can send electric pulses through and record how the heart responds. What treatments are available for heart disease? Treatment for heart disease largely depends on the type of heart disease you have as well as how far it has advanced. For example, if you have a heart infection, your doctor is likely to prescribe an antibiotic. If you have plaque buildup, they may take a two-pronged approach, prescribe a medication that can help lower your risk for additional plaque buildup and look to help you adopt healthy lifestyle changes. Treatment for heart disease falls into three main categories. 1. Lifestyle changes. Healthy lifestyle choices can help you prevent heart disease. They can also help you treat the condition and prevent it from getting worse. Your diet is one of the first areas you may seek to change. A low-sodium, low-fat diet that's rich in fruits and vegetables may help you lower your risk for heart disease complications. Likewise, getting regular exercise and quitting tobacco can help treat heart disease. Also look to reduce your alcohol consumption. 2. Medications. A medication may be necessary to treat certain types of heart disease. Your doctor can prescribe a medication that can either cure or control your heart disease. 3. Surgery or invasive procedures. In some cases of heart disease, surgery or a medical procedure is necessary to treat the condition and prevent worsening symptoms. Is there a cure for heart disease? Heart disease can't be cured or reversed. It requires a lifetime of treatment and careful monitoring. Many of the symptoms of heart disease can be relieved with medications, procedures, and lifestyle changes. If you believe you may be experiencing symptoms of heart disease or if you have risk factors for heart disease, make an appointment to see your doctor. It's important to take charge of your overall health now, before a diagnosis may be made. This is especially true if you have a family history of heart disease or conditions that increase your risk for heart disease. Taking care of your body and your heart can pay off for many years to come. That's all for this video. If you find it useful and you liked it, please click on the like button below the video, and subscribe in your channel, Be Your Doctor, and please don't forget to activate the bell to get all our new videos in your notifications. Have a nice day.